This segment of Delmarva Live is brought to you by Peninsula Home Care.
So we visit the doctor's office, we hear nothing back, so we assume no news is good news, right?
That's not always the case. In fact, no news after a routine test nearly cost one woman her life, and experts warn it happens more than you might think.
Susan Daniels enjoys simple moments with her family. It's time she wasn't sure she would have.
Things in life happen for a reason. I don't know what they are, but I can tell you that I've learned a lot through all this.
Her story began 5 years ago when she went to her doctor of 20 years for a pap smear.
One who'd birthed all three of my children.
When the office didn't call with results, Susan thought she was fine. But 2 years later, her doctor discovered a cervical tumor so big it was inoperable. She was referred to Dr. Christine Lee.
This all stemmed from an abnormal pap smear that wasn't caught.
Susan underwent chemo and radiation, but the cancer came back. Dr. Lee gave her two choices: death within a year or have a major surgery to have a complete hysterectomy as well as her rectum and bladder removed.
I was horrified. I didn't know if I wanted to live the rest of my life with a colostomy and a urostomy.
We see it, unfortunately, enough.
Dr. Lee says it's critical patients become their own advocate and request a hard copy of their test results.
Offices get busy and nurses will, or well-intentioned staff in the office will say it was normal, but it's actually a different patient's pap smear. That has also happened.
While Susan says she can't change what happened to her, she hopes her story will help others.
Don't assume that no news is fine. Whenever you go and have a test and you pay for those test results, get the test results.
Now, since the operation, Susan had reconstructive surgery and is now cancer-free. She will live with the colostomy and urostomy for the rest of her life. While she says some people encouraged her to take legal action against her doctor, she says she feels equally responsible.
Susan's story is just the perfect proof of just how important that strong connection between the patient and the healthcare provider needs to be.
And that is why Peninsula Home Care is turning to community health workers to serve as that connector.
Your sister's birthday today? That's wonderful.
93-year-old Lucy Groff of Salisbury lives on her own, and she wants to keep it that way.
I'm able to take care of myself, cook my meals. I can get around. I don't keep the feet on my wheelchair on purpose because I pedal. And I want to pedal around to keep my legs and feet going.
But Lucy has congestive heart failure and COPD. Managing these chronic conditions proved to be a bit overwhelming to Lucy, forcing her to make frequent trips to the hospital. That put her independence in jeopardy.
I don't want to have to be in any place. If I can help it, I'd like to have my freedom and just keep living like I would.
And she can, thanks to Peninsula Home Care's Community Health Worker Program.
Hi, Kelly, come on in.
Hi, Miss Lucy, how are you today?
Kelly English is a community health worker assigned to Lucy's case.
Community health workers are going to be certified nursing assistants who will have education and chronic disease management training.
But community health workers do so much more.
A typical visit, go into the home, we talk about any things that have happened during that week. We talk about our action plans from the week prior, if they met their goals or if they're having trouble meeting their goals. And then we go over what are the new action plans for the upcoming week, or if they need assistance with Shore Up, Meals on Wheels, or transportation.
Peninsula Home Care's Community Health Worker Program is actually a collaboration with Peninsula Regional Medical Center.
Healthcare is moving to a goal where we must act outside of the walls of our facility.
The goal is to keep people like Lucy out of the hospital.
We've had a pilot program going, and so some of them are frequent flyers to the emergency department we've used over the last few months and have proven to set some action plans for them and put some services in place that have helped them to keep from coming back to the hospital, being readmitted and having to start over.
The relationship between Lucy and Kelly seems to be working.
She makes sure about my health, and since she's been coming to me, I haven't had to keep going to the ER, and I haven't had to be in the hospital because she makes sure I have my doctor's visits right, and my medication.
She's takes her medication. Sometimes we have some problems with some swelling in her legs, and I've had to call the doctor to get Lasix ordered for her. I've also had to call the doctor to get her a doctor's appointment, but she's very, very, very compliant for me.
Kelly is also in communication with Lucy's physicians.
We're not only working with PRMC post-discharge, but we're also making sure that the primary care physician, or maybe it's their cardiologist who are following them, have information that is relayed back to them after we make these visits with these patients. It's really the movement towards more collaboration. It's always been in healthcare, if we see you now, we discharge you, you hand off to the next person, they do theirs. This will be, collaboration will be the expected and not the exception to the rule.
And Nancy says people receiving services from community health workers are referred to as clients instead of patients because each person's needs are unique. Now, some may require clinical care while others are in need of social assistance such as food security or help navigating a particular insurance or Medicare system. They also don't have to be homebound to receive the service. And if you would like more information on Peninsula Home Care's Community Health Care Worker program, go to our website, wboc.com, click on our picture at the top of the page.